Bismillahirrahmanirrahim. Inshallah, today we will start with our mass presentation of the PBL session of basic pathology from first trigger until the fourth trigger. Okay, this is the flow of our presentation. Firstly, we will discuss about the PBL summary, the full and complete medical history of Razak from PBL 1 until PBL 4. And the second one, we will talk about osteosarcoma. We'll explain the definition, the test, the risk factors, pathogenesis, and treatment for osteon and Islamization of the whole PBL. Okay, firstly, for the first trigger, okay, the information that we can retrieve from the first trigger is that the patient is a 15-year-old male student named Razak, and he was sent to the hospital after falling while playing football, representing his school a few hours before that. And he was said to be in an intense pain and unable to move his injured leg. And the attached picture showed that his ankle has become swollen. And from our discussion of the first trigger, we have come up with three assumptions. The first one is acute inflammation, which is a short-term and rapid process that occur in response to infections and also tissue injury. And this is based on the signs of inflammation that can be observed from the trigger and the picture, which are pain, redness, swelling, and also loss of function. And the second assumption is ankle sprain, which is an injury of the ligaments of the ankle when it is accidentally twisted. We assume that he had suffered from a moderate ankle sprain because his ankle is swollen and he experienced pain. And the third assumption is joint dislocation, which refers to the complete loss of a position of the articular surfaces of the bone comprising a joint. And to conclude the first trigger, we can conclude that Raza experienced acute inflammation and because he had shown the symptoms of the inflammation. And for the other two assumptions, further diagnosis of the injury is needed to confirm his condition. I'll pass to next presenter.
Okay, so for the next PBL, which is the PBL session 2, we obtained the information of that Razak have informed that 2 weeks ago he had a fall during the training and suffered a cut on his right ankle, and he only applied the ointment. And then, however, 3 days ago he developed symptom, which is the fever, and then his right ankle becomes swollen. And then he ignored the symptom and went on playing for the football tournament. And then he have an medical examination, which is the X-ray, and then based on the X-ray result, the a specimen of his uh, bone have been sent to undergo the closed needle biopsy for the histological examination, and then based on the closed needle biopsy result, intravenous antibiotic treatment was started. And then, okay, so this is the result of the X-ray and the histopathology of Razak bone. As mentioned in the trigger, that there is a lytic lesion at the right ankle, and then the lytic lesion at the right talus, and it's surrounded with the soft tissue shadows, which show the demineralization of the bone. And then the lytic lesion is like a softened section of a patient bone formed as a symptom of a specific disease. And then this softened area appears as a hole in X-ray scan due to the decreased bone density. And then we can suggest the bone destruction may be from bacteria. However, there are actually many other diseases that are associated with this symptom. And then the result of the histopathology show that there is a possible development of the sulcustrum, which is the piece of the dead bone tissue formed within the disease or injured bone. And then we can see like the presence of the neutrophil in acute inflammation. The predominant infiltrating cell is the neutrophil. So through few and then the microabscess formation is in the marrow space, which is the aggregate of the neutrophil and other inflammatory cells. And then it's like our body defense reaction to the foreign material. So, and then from the PBL, when we assume that we assume that Razak got joint dislocation and sprained ankle, and we rejected that idea due to that, because based on the erosion of the talus talus bone and the infiltration on the inflammation cell in his bone, and plus the patient history of getting cut at his foot and other symptoms such as fever and swelling, we rejected the idea which is the joint dislocation and the sprained ankle. And then we assume that Razak got a bone infection, or in medical term called osteomyelitis. That's all.
Okay, Bismillah. Next we go to the trigger PBL 3. Okay. So first we go to the information that we got from this trigger. The first information that we got is Hazak has completed antibiotic treatment, but his condition worsened. For example, his joint was painful and the swelling of his ankle was not subside. This reject that the osteomyelitis idea which caused by bacteria, because the antibiotic treatment was not improve the Razak condition. Okay, so the second information that we got from this trigger is we know about the medical history of Razak. First, we know that Razak had eczema since childhood. He underwent radiotherapy session until 9 years old. We also know that his parents were farmers. And the last information that we got from this trigger is biopsy was performed and evaluated. So therefore, based on the fact from this trigger, we come out with two ideas. The first is radiation exposure. Long radiation exposure may lead to cancer. As we know that Azak had eczema since childhood, so he underwent radiotherapy session until 9 years old. And that radiotherapy session may lead to the cancer. The second idea that we got is pesticide exposure. High and prolonged exposure to pesticide increase the risk of cancer. As we know, the occupation of his parents were farmers. Therefore, Azak has been exposed to the pesticide since childhood. It may cause him to have higher risk to get cancer. And based on the idea that we come out from this figure, we can conclude that Azak may have suffered cancer. And that's all for figure 3. I'll pass to the next presenter.
Bismillahirrahmanirrahim. Inshallah, we go to the figure 4. Basically, the information that we got from the figure 4, the first one is Razak undergo the genetic test, and the result show the SMP, or the single nucleotide polymorphism of GRM4, or glutamate receptor metabotrophic 4. And the second one, Razak undergo the blood test, and the result show the blood test result show that high level of alkaline phosphatase, and also the high level of lactate dehydrogenase. And the last one, the histology result also showed in this figure was after the Razak underwent the biopsy test. Okay, we go further about this. The first one is in the genetic test that Razak undergoes is show the SNP of GRM4 that caused by the genetic mutation due to the exposure to radiation and also the pesticide. As we know that it is related to the trigger 3 that we can see how the exposure of the Razak to the radiation and also the pesticide. And based on this, we already know that GRM4 actually one of the function is as a tumor suppressor, which inhibited the proliferation, invasion, and also the migration abilities of the cancer cell. And for the blood test, which is high level of the ALP, alkaline phosphatase, and also high level of lactate dehydrogenase, will show one of the sign of indicator which lead to the osteosarcoma, because when the high level of lactate dehydrogenase and also the alkaline phosphatase, it will show the sign to damage of the body's tissue. And for the last one is the histology result that we can see here. There are a few indicator or a few sign that show the histology result that some abnormality will found in this picture with the abnormal mitosis, spindle cell, and also the osteoid. We go to the next presenter, inshallah.
So next, we already know that from all those discussion that Razak suffered from osteosarcoma. Next slide. We will learn about osteosarcoma. So basically, osteosarcoma can be defined as osteogenic sarcoma or bone cancer, and it is common in teenagers and children because they are having the peak of their development in the bone development. Next, for the risk factor for osteosarcoma, particularly for Razak, firstly is environmental factors, which actually has been mentioned before, because of the radiation exposure that can lead to higher risk of getting cancer. And then germline genetics, which is indicated by the mutations. That mutation specifically on this case is the SNP of GRM4. And last but not least is growth, which is, we already know that Razak is a 15 years old boy. So basically at that age, the bone development is at the peak. And last but not least is for the treatment for osteosarcoma, we have surgery, chemotherapy, and radiation therapy. Next slide. Now we will move on to the pathogenesis of osteosarcoma. So this is basically all of the pathogenesis for osteosarcoma. It is start with the predisposing risk factors, which are in this particular case is germline genetics and environmental factors. Thus, it will cause the NE mutation, and then it will cause the overcrowding of malignant osteoid tissue in the bone, and then it will cause the suppression of bone marrow, cancer cell metastasis, increased pressure in the bone that can be manifested in the patient itself, which is the feel of pain, swelling, and in some cases, fracture. Next slide. So next part, I will pass to the next presenter.
As a conclusion, I will summarize what is the flow of this PBL from the first trigger until the fourth trigger. This case is about 15 years old boy named Razak. During his childhood, he developed severe eczema that needed him to undergo a series of radiotherapy for the treatment. At the age of 9 years old, Razak was fully recovered from eczema and stopped his radiotherapy session. Next, when he was 15 years old, Razak had fall during his football training and suffered a cut on his right ankle. He only applied an ointment on the wound. 11 days later, Razak developed fever and he noticed his right ankle become swollen. But still, he ignored the symptom and went on playing for the football tournament. 3 days later, during the tournament, he fell for the second time. He went to the imaging process and the result shows that his ankle showed a lytic lesion, and the doctor prescribed him intravenous antibiotic or IV antibiotic. Razak also suspected to suffer osteomyelitis. Lastly, even after he finished his antibiotic treatment, his condition was not improving. The biopsy and genetic test was performed and it is confirmed that Razak suffering osteosarcoma. For the Islamization, based on Surah Al-Anbiya, verse number 16 and 17, the meaning is, we do not create heaven and earth and everything in between them as a game. If we had desired to have some amusement, we would have derived it from our present, but we did not do that. It is show that the Almighty Allah Subhanahu Wa Taala created everything for a reason and with a goodness. For example, Allah allowed the disease to happen because He gave a chance for the doctor and the scientists to understand the causes of the disease and the connection between warning and reaction and even the small detail in this connection. Only then they would know to produce medication that can reduce pain or treat disease in the cases of bodily injury.